Well, hello, I'm Shelley Irwin. Thank you for joining us tonight on Ask the Optometrist. Of course, call in with your questions. Those numbers will be on the screen throughout the show. It's all about your questions. That's what's important. Our expert in studio tonight, welcome back to you, Dr. Patrick Holzer. Of course, optometrist. Glad you're here. Advanced Eye Care of Grand Rapids. Busy gentleman you are. How are your eyes doing at this point in your life? Good,
pretty good. I'm a contact lens wearer, so I use contacts, some daily disposable lenses. I'm pretty nearsighted, so I can't see much, so they go on first thing in the morning, and I take them off, a couple minutes before bedtime. But yep, use contacts, and I have for 15 or 20 years now.
Yeah.
So yeah.
Are we going more with the disposables, Pat?
Oh yeah, most definitely. Less risk of things like infections and poor hygiene habits and things like that with the disposable lenses. We can throw them away every day and put fresh ones on. We've also got some that you wear for 2 weeks at a time, a month at a time, those type of things. But the healthiest by far is to put a fresh lens on every day.
Can you scratch your eye by putting a contact lens in?
Or
taking
it off?
Yeah.
Yep, both actually. So yeah, and that's one of the reasons it's important to properly get proper instruction on putting the lenses in and out, so that you don't scratch the eye, because then you can get an infection where that scratch is and have all kinds of problems. Maybe not even be able to wear contacts after you have an infection. So yeah, it's important to learn the right way to do it. That's for sure.
Right. Nearsighted versus farsighted. Contacts are mostly for the nearsighted.
For both, actually.
Yeah.
For both. Definitely nearsighted folks, can't see much without their glasses or contact lenses, so that they're pretty reliant on them. Farsighted people, if they have a low amount of farsightedness, they can still see pretty clearly. It's when we get into the higher amounts that they can't see far, close, both together. So yeah, we can do contacts for those folks as well, and there's lots of variety for them.
Yeah. Are you doing different exams for the contact lens versus the glasses?
Oh yeah, it's a couple extra steps. Not only are we, the eyeglass portion of it is the starting point, and then because contacts are worn right on the surface of the eye instead of about 14 millimeters in front of the eye, we have to do some calculations to calculate a different power and strength, and then also we monitor the health of the eye. The contact lenses, again, because they rest right on the cornea or the front surface of the eye, we have to monitor the health periodically. If everything's fine, usually it's about once a year. If we have problems, it's a little bit more often than that, so that we can keep healthy contact lens wear so we don't run into trouble and problems.
You bet. We only have two eyes, don't we?
That's right.
We are approaching allergy season. Do you see this as a problem with for a lot of us?
Yep.
Yeah.
I think our spring allergy sufferers, they can concur with me. It's already started. I've seen several already, and we've been writing prescriptions for them. Itchy, red, watery eyes are pretty common for allergy sufferers. There's a lot of over-the-counter medicine that's good out there for it. Problem with the over-the-counter medicines is they're pretty short-acting. They only last a half hour to maybe a couple hours. Where you have some good prescription medicines out there that we can take it once a day, and it gives us good relief from those itchy, red, watery eyes. Contact lens wearers also suffer a little bit more, I think, because the eyelids, which are affected by the allergies the most, those are in contact with the contact lenses, and it can make the contact lens wear uncomfortable. Some folks even stop wearing their contact lenses during the allergy season. So if you're one of those people, I'd say get in to see your eye doctor, and we can get you on some allergy medicines to help out with that. Some of the prescription medicines, the oral medications or the pills like Claritin, Allegra, they actually dry out the eyes, so it makes it a little bit worse with those itchy, red, watery eyes with allergy season. So using an eye drop medication helps quite a bit more, actually.
Yeah. Staying on the topic of the seasons, hopefully soon we're getting into the heat of the season. Obviously, be careful around the sun with our eyes.
That's right. We want to wear sun protection. Just like when you go outdoors and you put on sunscreen, you want to do the same thing for your eyes. Most of the glasses that go out of an eye doctor's office nowadays are going to have UV protection on them. I'd also recommend sunglasses with UV protection. We need to filter out all those harmful UV rays. They're a culprit in causing things like cataracts, macular degeneration, even cancers around the eye, skin cancers and things like that. So we want to filter out all those harmful UV rays. with a good pair of sunglasses. So make sure that they block out those UV A and B rays so that they don't cause damage to those structures. As far as what types of sunglasses, there's all kinds of different lenses. Some people like just colored sunglasses, that filter out the light. There's also polarized lenses where it actually filters out the reflected light, like we get on the hood of our car or on the road, or last season off the snow in the winter time. And for those outdoorsmen off the water, it will filter out that light so we can see a little bit sharper or clearer.
And we can burn our eyelids just from either sunbathing or
Yep,
hanging out?
Yep, burn the eyelids. Also, the retina, or the inside lining of the eye, can get burned if you were to stare directly at the sun. So you never want to do that. You probably remember back in the days your parents would tell you not to look at the sun, and that's definitely the case. We don't want to look directly at the sun for any amount of time because that can cause damage to the retina or the inside lining of the eye.
Yeah. First time in for an eye doctor check, when would you establish this?
For kids, I would recommend in the first year of life. We can do a lot of things there to make sure our vision is on track. Vision's a developed sense, so that means that we're not born with perfect vision. We have to acquire all the skills. So not only seeing clearly, that's one of the skills, but also our eye teaming, our eye focusing, our shifting focus from far away to close, and then also our eye tracking abilities. Those are all skills we use later on in life when we read, computers these days, those type of things. So we want to make sure they're on track. Usually in that first year of life is a good time. 6 months to 12 months is great. In fact, there's a public health program right now called Infancy. There's a lot of doctors participating. I do at my office, where during that first 6 months or 6 to 12 months, the exam is free. And we're doing a basic exam there, looking inside the eye, make sure everything's healthy, and then also checking those visual skills I just talked about.